So I'm Sajjad Ahmad, I'm a corneal and cataract surgeon, so my main clinical interest is in the front of the eye and diseases of the front of the eye. The reason I went into eye surgery or ophthalmology in the first place was because I noticed during my medical training that patients who suffered with diseases of their eye could get seen and treated in clinic or have surgery done where it made a huge impact on their quality of life. The procedures surgically, technically are interesting because they involve operating under the microscope. So you require a lot of eye-hand coordination. Those are things that technically have always excited me. So in my career, I have an interest in treating patients clinically, but I also have a huge interest in research. So I have a laboratory group which looks at how eye diseases develop and, more importantly, tries to identify compounds or molecules or cells that can then be used as treatments for eye disease. So for example, in some of the treatments that we've been working on for the last 15 years for chemical burns, we now have a stem cell based treatment that can have a huge impact on improving visual outcomes. So I have an interest in laboratory work or research, but I also have an interest in taking those laboratory findings into the clinic. So I do a lot of clinical trials. So these are what we call first-in-human studies, and also when we do larger studies in looking at how new drugs or new products do in large groups of patients. So we look at things like how much they improve the vision or their symptoms, but also look at the side effects that they might have. The other thing is that if you've ever experienced any problems with your eyes, even if you've had a chalazion or a sty on your eye, you will notice what impact it has on your quality of life. And some of the patients I see have chronic diseases that go on for years. And the important thing for me is to try and make their quality of life better, and to enable them to do what they want to do in life, do their jobs, because eye disease, not only visually but also for discomfort, has such a big impact.